Hi, Dr. Gold. Let's talk about astigmatism, what it is. Give us the layman's term word for it. Give us the symptoms, and definitely tell us, can it be repaired with LASIK surgery?
Absolutely. Laser vision correction can remove astigmatism. In astigmatism, the patient perceives blurred vision no matter where they look, whether it's close or far, or right or left or up or down. Everything is blurry. And the reason is that the optical system is shaped like an oval, like a football, as opposed to round like a basketball. So when we do laser vision correction, what our goal is to restore the roundness to the optical system. And we do that by correcting more in the vertical position than in the horizontal position, for example. Just think about a football or an egg, and it is not a round surface. If we make it round, then the eye's focusing muscle can then focus light rays where they're supposed to be. And that restores the vision to clear. And just like with nearsightedness or farsightedness or presbyopia, the correction is indefinite. It really does not go away. Astigmatism in the early days of laser vision correction, the FDA did not allow us to correct, even though the technology was there. They didn't allow us to use it. But it's now been at least 10 years, possibly more, that we've been able to correct astigmatism with laser vision correction.
Wonderful. Now, first of all, you said, nearsightedness, farsightedness, and presbyopia, which is the reading, needing the reading glass type of stuff, right?
Right.
Okay. Now, and we have this astigmatism. So tell me, can a person have Can a person have one or two or more of those problems together? Can it be farsighted and have astigmatism, or nearsighted and have it, or reading glasses and have it? Because they all seem to be so, so close, connected to it.
The majority of patients who have optical defects in their vision have both farsightedness or nearsightedness or presbyopia and astigmatism. It's really pretty rare in my experience to find an eye that has zero astigmatism. In some patients it's minor enough that we don't have to correct it. But in most patients we do have to correct it, especially because we have the technology to do so.
Right.
So this is really high precision work. So even if there's a little bit of astigmatism, we should correct it.
Especially since it lasts, forever. It's not like the guy has a half a pound or a couple pounds too much, and it's not really a big deal, and then go through a major surgery when yet in 2 months with a couple hamburgers he will put it back on it anyway. That would be like not a really good thing to necessarily do. But if you correct a little bit of blurriness, astigmatism, it's corrected forever.
Basically true.
Wonderful. Well, let me ask you. So it's corrected forever. You can do both of them. The examination will show where the person has a problem, far, near, maybe both. You said that in some other video, and he has astigmatism also. You can go and correct them all.
That's right.
In one surgery.
That's right.
And it doesn't make the surgery more, let's say, life-threatening, so that he walks out being blind forever. It doesn't. Whether you correct 1, 2, or 3 symptoms, doesn't really make a big difference anymore for the patients. There's no increased risk. Yes or no?
Yeah, yes, that's true. All it requires is different settings with the laser. The surgical technique is the same.
Right. And he's not handicapped then longer or so. He's still a couple of days, whatever, 2-3 days later, it's all fine again. And even during those 2 to 3 days, he can be up and about. And by the way, those 2 or 3 days, that's the big difference between epi surgery and and normal LASIK surgery, where yes, you have a little bit more healing time to do, in a very minor way, because you still can see and work, but it's a little bit longer. However, you're doing episurgery with literally no cutting, and thus it's safer for the patient in the first place. Am I right?
That's right, especially with this new information that the LASIK flap never completely heals. If a person has had LASIK and they get poked in the eye accidentally, 5 or 10 or even 20 years from now, that flap can still come loose. Whereas with epi-LASIK, there's nothing that can come loose. That's its major advantage.
Right. That's a other major advantage. The first one, you're already not doing any cutting, because, every doctor will, every surgeon even who is like trained to do surgery, whether it's hip surgery, tonsils, doesn't matter what, he will try to stay away from any unnecessary surgery if he can. Even my dentist does so. And so that in itself, not being cut areas in the eye must be a big advantage. Then there comes the advantage that what about if you get poked in the eye with a normal LASIK surgery, you have that flap, and it doesn't have to, it could then create a little problem, right?
Right. In my career of doing 10,000 LASIK procedures, there were only 4 times that a person got poked in the eye and their flap came loose and we had to repair it. But that's 4 more times than is ever going to happen now that I only do epi-LASIK.
Right. And that flap coming loose, is it in any shape and form life-threatening to the eye, like that the eye could be permanently damaged?
It is vision-threatening for sure, and it has to be repaired. I tell my LASIK patients, if you ever get poked in the eye, find me right now, day, night, Christmas Eve, it doesn't matter. Find me so we can fix it. Because otherwise, you may need a corneal transplant to get your vision back down the road.
Okay, now, that being poked in the eye, find me right away, does not apply to epi-surgery also?
In epi-LASIK surgery, there's really nothing to come loose. So if they get poked in the eye and they don't feel any symptoms from that, they can talk to me the next day and just let me know that it happened. But it's not urgent. Got
it. And you're, of course, not doing anything else but epi-surgery anymore?
That's right. Since the information came out earlier this year that flap never heals 100%, I have stopped doing LASIK.
Well, of course. That's called being a researcher. That's of course going and finding something out and then acting on it.
And there have been a lot of people over the years who have thought about LASIK, but could not get past the idea, my eye is going to be cut.
Right.
Well, that's the beauty of epi-LASIK, is there's no cutting. So this is going to open the procedure again to a large percentage of people who had that fear of cutting because there's no cutting.
Right. Beautiful. Absolutely wonderful here. All right. So basically, whether there is farsightedness, nearsightedness, reading glasses needed, and or astigmatism, in whichever combination they come, and with elder people they could come in many forms. Basically, the person could have a little bit of all. The LASIK surgery will fix it up. You guys know how to adjust it and fix it, and a guy comes out and seeing bright again.
That's great. That's exactly true.
Wonderful.